I too would like to thank the Press Club for helping bring us together today, and also AmericaSpeakOn.org for organizing this important event to bring together some bipartisan discussion on healthcare reform. One of the things that I wanted to highlight is that there do seem to be a number of important areas of agreement in getting the comprehensive health reform. And not just a matter of having everyone at the table, but actually having the policies and the political path to get it done.
I would hope that we could agree on several things as a sort of a premise to this debate and this important moment. One, that we have not succeeded in the past in part because we have failed to come together and to reach the common ground required to do something this transformational. And that the year 2009 presents yet another opportunity for us to reach this transformational moment where we really could make a dramatic improvement in the level of health care that we want to provide all Americans for future generations. And it seems to me that if that is a possibility, we have to first agree on what the problem is. And I've always thought that the problem can be defined in really three categories. I think we have a serious access problem, one related to the fact that 50 million people don't have insurance, and according to the Commonwealth Fund and others who have researched this, a large number, perhaps as much as 48% of American people, don't get the care they need simply because they're underinsured. They don't have the capacity financially to pay for the care that they need. So we have a serious access problem that also relates, of course, to long-term care, to mental health care, to dental care. The complete coverage is a factor as well as regard to coverage. The second problem we have is quality. As much as we'd like to think that we all go to a Mayo Clinic or an Intermountain in Utah, we don't do that. We have a serious quality problem, and whether you agree with the World Health Organization or not, it claims that we rank 37th in overall outcomes. We have a problem with regard to life expectancy, infant mortality, women's health, and an overall a problem that continues to be exacerbated by all the other issues that are facing us in the healthcare delivery system today. And finally, and I think what's driving this more politically than anything else, we have a huge cost problem. A problem related in part to the fact that these costs are escalating at a rate beyond even inflation. And if we do nothing, those costs are going to get a lot worse in the next 10 years. When we spend 40% more than any other country and come in 37th in outcomes, we know we've got a cost problem.
We have to begin to focus on real reform that changes the system. Now, I've begun to see over the course of if you look at the 20 or 30 year history of this, there are really three reforms that traditionally come to the forefront that I believe are not real reform, that are what I would call fake reforms. One is often advanced by my own party, and that is the idea that the market somehow will resolve this. The reality is the market is a very important part of this, but in and of itself, it requires organization, and the markets have to be structured and organized. And so just turning it to a market that's unstructured and unorganized will not solve the problem in and of itself. The second, what I think is a fake cure, is that somehow, if we get enough bureaucracy, that they can make the decisions that will somehow drive the cost down. That's not real reform. And the third that I believe is often the default position is that if we just spend more money, we'll be able to solve this dilemma. Solving this with just more money is like prescribing for a chronic obesity a double regimen of calories on a perpetual basis. That won't solve the problem. So we have to talk today about real reform. How do we change the way the system works? I've often said in the presence of those here that we talk about a healthcare system. What we really have is a healthcare sector that is big and robust and rapidly growing. There's not a lot about healthcare today that qualifies it as a system. Much of what we're accomplishing, need to accomplish, is transforming this economic sector into an economic system that is driven toward value more than volume, that provides consumers with real information about what they're consuming, that begins to reward those who provide the highest quality care at the lowest possible cost. The kind of dispassion that's required to make these difficult decisions cannot be made by a market alone. It cannot be made by bureaucrats alone. It will not be resolved simply by spending more money. It requires government taking strong action. The strong action action, however, should not be to own the system. It should be to organize the system in a way that provides all Americans access to health insurance they can afford in a way our